to Gem, I'd like to introduce you to Stacey Bisson, who works also in the Strengthening Communities team, and is very much involved with this work for Worcestershire. So, Stacey, would you like to introduce yourself and say a bit about what your responsibilities are within our team?
Yeah, no problem. So hi, everybody. I'm Stacey Bisson, and as Esther said, I work in Strengthening Communities for Worcestershire County Council. I'm one of the Armed Forces Covenant officers for the council. So we work both with the Armed Forces Covenant Strategic Partnership, which is chaired by Councillor Richard Tudge and has representation from our strategic partners across the county. But we also look after the operations group that meets quarterly, more of an informal group that has significant VCS representation. And just wanted a plug for that if you'd like to liaise with us with the ops group in any capacity or want to link with the group, then I'll pop our email address in the chat in a moment. So if you do want to link in with that group, please do get in touch with us that way. I'm sure at some point, definitely Gemma will touch on about the new duties coming out soon. And one of the Armed Forces Covenant roles at the council is to help facilitate those conversations and develop an action plan. So for us, it's about ensuring that Armed Forces families and veterans are not placed at any disadvantage by anything that we do as a county council, and then any wider responsibility that we look after. And a little plug, because I always do while I'm here, for our Community Services Directory, that if anybody does want to find out more about any services that are local to Worcestershire, you can have a look on our Community Services Directory, available through the Communities button on WCC's website. But we're also planning to update a pocket guide of services that's currently in place that will be distributed to everybody once it's developed, so that you can much easier access and signpost to any of those veterans and armed forces families. And I'm sure Gemma will answer any questions that you've got that she can during today. But if anything occurs to anybody afterwards, please do send to the email address that I'll pop in the chat, and we can help to direct those questions and those queries to the appropriate source. So it just means that won't be missed. So that's enough about me. It gives me great pleasure to introduce Gemma Warden from Defence Medical Welfare Services, and she will disseminate her wealth of knowledge about all things armed forces and veterans to you all. Over to you, Gemma.
I shall do my best. So I'm Gem Warden, and I'm the Thrive Together Programme Manager, and I work for Defence Medical Welfare Service. So I'm going to share my screen with you. So if you just give me a moment, I shall share with you and explain a bit more who DMWS are. There we go. So hopefully you can see, give me a thumbs up or a yay if you can see my screen. Super stuff. There we go. So due to our time today, so we're quite limited in time. So this is intended, I suppose, to be a Armed Forces Awareness Light session. So I'll touch on several different topics, but I will be sharing the presentation along with some follow-up resources. And amongst those resources will also be some links to some more comprehensive training, should you wish to engage in some further training. So I'm the Thrive Together Programme Manager here at DMWS. So who are Defence Medical Welfare Service? So we provide welfare support to the armed forces community right across the UK. We also provide welfare support in Cyprus. We are a charity, and our support is absolutely free. So our footprint, so as an organisation, we're embedded in over 46 NHS trusts. That includes having armed forces welfare officers, and we've got one based across the hospitals in Herefordshire. And we also have a hospital welfare officer based across the Worcestershire hospitals as well. So we operate a National Response Service helpline to the armed forces community. And we also provide services on behalf of the MOD to serving personnel as well. So we've got a welfare team based in the Royal Centre for Defence Medicine. And like I said, we also provide welfare support abroad in Cyprus too. We support the Veteran Covenant Healthcare Alliance accreditation, and we're also a delivery partner of several of the services that are available. But alongside this, we also provide welfare support to other frontline services. So we provide welfare support to the police and also NHS staff. So I manage the Thrive Together portfolio for the Midlands. So what is Thrive Together? So boiling it down into some quite simplistic terms, Thrive Together is a national programme that is funded by the Armed Forces Covenant Fund Trust, and that funding comes direct from Treasury. £10 million was assigned for the Thrive programme over 3 years. In a nutshell, the programme seeks to improve cross-sector collaboration to support the armed forces community, improve pathways for the armed forces community, but also build capacity in organisations as well. So we work with a wide range of funded and non-funded organisations. So we did a huge consultation across the Midlands last year. And that consultation involved focus groups with VCSE organisations, with veterans, with carers, with statutory services, and we pulled our findings together into a regional strategic plan. And as part of that plan, we are supported by a funded portfolio of organisations to achieve our aims. So as part of our portfolio, we have small community organisations like hubs. We work with Citizens Advice in the North East. We are funding City of Wolverhampton Council. We also work with national charities like Combat Stress. So we work with a huge range of varying organisations to do our work. So each region in the UK has its own organisation leading their regional portfolio, but we lead in 2 of those regions. So I thought I'd start by sort of posing a question. I was going to use Slido, but people never ever respond when I put it on the slide. But just to think about, who are the armed forces community? What do you think about when you think about the armed forces community? And quite often when I pose this question to groups, people will say Army, RAF, they will say veterans, but quite often the community is a little bit broader than you may anticipate. So the armed forces community is made up of regular personnel, so current serving members of the Royal Navy, the Royal Marines, British Army, the Royal Air Force. It's also volunteer and regular reservists. It's veterans, so anyone who has served for at least a day in the armed forces as a regular or a reservist, or merchant mariners who have seen duty on military operations. So a veteran can be 16 or a veteran can be 106. And the veteran community is as diverse as the rest of society. But it's also families. It's the families of regular personnel, reservists and veterans, it's spouses, it's partners, it's the children, and it's also the bereaved. So the family members of service personnel and veterans who've died, whether that death is in service or not. So one of the things that came up in our consultation was that actually families quite often feel left out of the equation, and sometimes they don't feel that the same level of service is there for them. So it's important to remember that families are impacted by service life too. So what does our local picture look like? So the figures are probably, in reality, this is census data, so the figures are probably in reality a little higher than this, because some people may not disclose their veteran status. So we have just over 21,000 veterans within Worcestershire. 14% of those are female veterans. We taking into consideration families, we've got a community of over 50,000 armed forces community in Worcestershire, approximately 500 military children in local schools, and we have 161 organisations in Worcestershire who have made a pledge to the Armed Forces Covenant. So Stacey's just touched upon. We have an Armed Forces partnership that's made up of a strategic group and also an operations group. We also have local authority champions. We've got councillor champions, and Worcestershire County Council is a gold employer recognition holder for the Armed Forces Employer Recognition Scheme. So we've got a really good, strong partnership in Worcestershire. So another question that I sort of wanted everybody to think about is, what do you think about? What springs to mind when you think about the Armed Forces community? So there's been several surveys that have been commissioned, and recently there was a YouGov survey commissioned. And when asked, the general public were asked, what did they think of when they thought of the Armed Forces community? What do they think of when they thought of veterans? Over 86% of the respondents said PTSD, and that was their first thought. And I think it's sort of really important to note that whilst a small proportion of the Armed Forces community have a negative experience and do encounter mental health difficulties, that it is not all veterans that suffer from PTSD. Not all suffer from mental health difficulties as a result of service life. Because these stereotypes can actually be really, really damaging to the Armed Forces community, and particularly damaging when it comes to seeking employment. So I've put a link in the slide for everybody, and this is to the Forces in Mind Trust Centre for Evidence. So this is a really, really good repository of research and data, real rigorous academic data. So if you are looking for figures for veteran issues or health issues or mental health difficulties, then please, I implore you, do look at the Centre for Evidence and use the data that's available there. And I've also put a link into the Veterans Data Dashboard for you there. But whilst it's important we don't stereotype, and we recognise that the Armed Forces community is incredibly diverse, it's also important to recognise that service life and civilian life are very, very different. And it's those unique differences that might impact how you support someone from the Armed Forces community. It may impact how they engage with you or don't engage with you. And it's these differences that sometimes create challenges upon transition into civilian life. So this is just a snapshot of some of the unique experiences of the Armed Forces community. So one of the things with the Armed Forces is provision of support. So in the military, you have your accommodation provided, your food, your healthcare. There's no struggle to get a GP appointment. There's little cancelled NHS appointments. You can see a dentist when you need to see a dentist. And you can see how that can present challenges when you leave the military and all of a sudden you are trying to navigate a really frustrating and complex system of statutory services. You know, in the military, people receive treatment when they need it, because having a fit and healthy armed forces is really important. But then all of a sudden you find yourself in the civilian world. You have to manage your finances, pay your bills, fill in forms. What might seem like a run-of-the-mill task for a civilian might be completely overwhelming to a veteran. Nonsensical, it may feel bureaucratic to them. So you can see where some of those frustrations may start to creep in when you are working with a veteran. So timekeeping, in the military, timekeeping can literally be the difference between life or death. So you do what you say you're going to do when you're going to do it. And sadly, civilians aren't so punctual. So being clear around timeframes when you're working with the armed forces community is actually quite important to not lose engagement. So you may face frustration if you say you're going to call at 12 o'clock and you don't call till 20 past 12. Because in an armed forces environment, that's just not what you do. So the military is hierarchical, so important to bear in mind. It's predominantly male. However, women serve, but this does mean that sometimes services are shaped towards male veterans and they're not shaped for female veterans. I'll touch on about that again in a minute. But it's the support unit. So in the military, you have your whole support unit around you, and you might lose this on transition. You suddenly go from having a whole unit and good people around you to transitioning into civilian life, and that has suddenly gone. So you may feel that, veterans may feel a loss of identity, isolation, a loss of sense of purpose upon that transition. And that's also true for families too, because they've also been used to living it in that different way. So military law, lots of people don't realise that military law exists. So military law and civilian law are different. The military has its own court, prison, its own police officers. Language. Another thing that was through and through our consultation data, the importance of language to the armed forces community. Military language is full of slang, it's full of abbreviations, it's full of acronyms. This may lead to feeling misunderstood by civilians. They may feel that civilians don't speak their language. But I say if you're working with a veteran and they use a term that you don't know, just ask, because they will absolutely love explaining it to you. So in our consultation, like I said, language came up over and over again. They certainly didn't like the word holistic, didn't like the use of the word holistic in support systems. With one focus group attendee that I absolutely loved said, why can't civilians just say what it does on the tin? Because that's what we want. Just give us plain language. Which sort of leads me on to humour. Humour is very much part and parcel of military culture. So, whilst not all veterans have PTSD, many may struggle with transitioning to navigating a civilian world, and that's where some of those challenges may come up that impact well-being. So, female veterans, I just wanted to touch upon, often services aren't shaped for female veterans, and their experiences can be really different to male veterans. Service imagery can often depict men, but there is a really good piece of work that's going on at the moment called the Female Veterans Transformation Programme, which gives access to lots of resources and toolkits, and I've linked that at the end. So LGBT plus veterans, I touched upon military law, well, before the 12th of January 2000, I did say 2000, it was illegal to be gay in the armed forces. So many people were removed from service. Some veterans were given criminal records. In the 1990s, we had serving personnel in prison for the crime of being gay. So therefore, LGBT plus veterans' experiences are very different, and you may find that they may struggle to engage with military services through a lack of trust, and this means sometimes they can fall through the gaps. So there was a huge independent review into this, and there is now a full reparations package in place that's open until next year, including financial award. So the link for that is at the end, should you wish to have a bit more information. So again, recognizing that minority groups exist in the military and their needs are unique too. There are some good recent reports into health differences for Gurkha and Fijian veterans, and all of that. Those sort of reports are on that Centre for Evidence that I've given you. Reservists, another group that have very different experiences. You know, due to some reservists are only working part-time, they're also working civilian roles as well. So sometimes they don't identify themselves with the word veteran, or they don't feel that services are there for them too. But they are still entitled to the same level of support as a regular serving personnel. So, you know, worth bearing that in mind. And lastly, families and dependents. Families have unique experiences too. You know, it's not all about just the veteran. Many have to deploy at short notice, leaving families, leaving friends. You know, they lose their support networks. They may struggle with long-term employment. They might have gaps in their CVs due to constant house moves. Children may have to move school frequently, which impacts education, their support networks, leaving family units behind. So, you know, you can see that actually those experiences in the armed forces community, it is a community, it impacts everybody, you know, not just the veteran. But, you know, alongside that, there are a set of values that are instilled to people in the military when they serve, which often filters into family life as well. So structure, loyalty, courage, resourcefulness, discipline, respect, commitment, teamwork, they're highly trained. Sometimes those skills aren't translated or recognised in the civilian world, but they are highly trained. And whilst you can see that these are all values that actually make fantastic employees, sometimes it also creates barriers when seeking support. So it can be really, really hard to ask for help when courage and selflessness is a core value that's been instilled in you throughout your service. So just a snapshot of, you know, some of those unique experiences that set military life apart from civilian life. So one of the quotes from one of our focus groups, which I thought summed it up really nicely. There's no handbook for civilian life. You just have to figure it out as you go along. I'm going to touch on the covenant. So one of the things that came up in our consultation with VCSE organisations, so we did six individual focus groups across the Midlands with a wide range of VCSE organisations. And one of the things that came out of that was confusion around the covenant. What is the Armed Forces Covenant? Is it different from the Covenant Legal Duty? Is the Fund Trust the same thing? Even our independent facilitator, when they were writing the report up, got completely confused about which one was which. And one of the attendees, when asked what their knowledge of the covenant was, at one of our focus groups said, "It's shrouded in mystery," which I thought was a great quote. So I'm just going to sort of talk you through what they are, what the differences are, and what that could mean to you as an organisation. So firstly, the covenant. So the covenant is a pledge. So the Armed Forces Covenant is a promise by the nation, ensuring that those who serve or have served in the armed forces and their families are treated fairly. So it's a pledge made by the nation. It's a pledge that you can make as an organisation to say that you will treat all of the armed forces fairly. But again, it's important to bust some more myths that can be perpetuated by military charities, by veterans, by the media. The covenant is not about priority, and that's something that gets said quite a lot. It's about parity. So it's about paying due regard to the impacts of military life and not disadvantaging someone for their service, including families. So it's not about priority, it's about not disadvantaging people. So I've got a couple of examples. So removing the need for the local connection for a housing list due to the transient nature of service is paying due regard and removing disadvantage. So it doesn't mean priority housing for all veterans. So it's about removing the disadvantage they face because of their service. So some other examples. So giving special dispensation to allow a service child to holiday in term time when the policy states no term time holidays is removing disadvantage when a child can't have a family holiday in holiday time due to service life, or ensuring a spouse isn't placed at the bottom of a waiting list due to service relocation when they've already been on the waiting list for 8 months in another region. So that's removing disadvantage. It's not giving priority. So I've touched on the pledge, but then we also have the Armed Forces Covenant Legal Duty. So the Covenant Legal Duty is a legal obligation on certain public bodies to have due regard to those covenant principles when carrying out certain functions in healthcare, education and housing. So public bodies subject to this legal duty include local authorities, governing bodies of certain state-funded schools and various NHS bodies. But this legal duty may start to impact you as a VCSE organisation, you know, if you are delivering a statutory commissioned service in any of these areas. You know, you may want to think about, if you're delivering a commissioned service, are you paying due regard to the armed forces community? So what we also know is we are awaiting the publication of the new Armed Forces Strategy Action Plan from the Armed Forces Government team. And they have announced that there is the intention to extend this covenant legal duty, and we expect that to be enacted within the next 12 months, and it is an extensive extension of that duty, and all policy areas in government will be expected to pay due regard to the armed forces. It will be rolled out across an additional 13 areas, which will include healthcare, education, housing, employment, adult social care, benefits, pension, the justice system. So we will start to see, you know, that will start to impact more and more organisations. So I've put a link here into the Covenant website. And what you can find on that Covenant website is there is a whole host of case studies. There is a toolkit on there. There is a whole wealth of resources. But I'm just going to play you a very quick 3-minute video from the Covenant team, because I think it gives a really good overview of that covenant and what it means to you. So hopefully you'll be able to hear my audio.
The Armed Forces Covenant is the nation's commitment to members of our armed forces, past and present, and their families. It ensures that the armed forces community are not disadvantaged in accessing goods or services, and allows for special provision for those who have given the most, such as the injured or bereaved.
It recognises the impact of service life on the armed forces community and helps to ensure that they are treated with fairness and respect. Service life can impact the armed forces community in many ways, whether it's through frequent house moves, separation from support networks, or unfamiliarity with civilian life. Accessing public services can be challenging.
The MOD works in partnership with government across the UK, the private sector, and charities to help address these issues. The Covenant supports the armed forces community in many ways, such as schools admissions protocols, veteran rehabilitation pathways, housing support, and health waiting lists.
Achievements include the Forces Help to Buy scheme, national insurance credits for serving spouses, and top mobile and insurance companies waiving cancellation charges when posted overseas. The work continues to ensure that the armed forces community avoid new disadvantages and are treated fairly.
The MOD collaborates with government and public bodies to ensure government policies support serving spouses, partners and children on issues such as childcare, continuity in healthcare and education and employment. MOD's Defence Relationship Management team works with businesses and local authorities to sign the Armed Forces Covenant, show their support as an employer, and maximise the mutual benefits of partnering with Defence in supporting armed forces personnel and their community.
Every local authority in Great Britain has signed the Armed Forces Covenant and works hard to ensure policies support armed forces communities and remove disadvantage wherever possible. This work ranges from ensuring clients are asked about armed forces connections, integration projects and policy changes, to greater engagement with local armed forces communities to understand their needs.
The Covenant duty raises awareness among service providers of how service life impacts on the armed forces community so that they and the issues they face are considered fairly. It does this by requiring key bodies delivering local services to pay due regard to Covenant principles in the areas of housing, healthcare and education.
Support for the Armed Forces Covenant continues to thrive, with public, private and charitable organisations across the UK supporting the Armed Forces community. If you have any questions about the Armed Forces Covenant, our website has more information.
So there we go. It's just a sort of overview, just so you can see, you know, the sort of work that is going on to remove that disadvantage, and how that might impact you as an organisation. So my final covenant is the Armed Forces Covenant Fund Trust. So the Armed Forces Covenant Fund Trust are a charity, and they're a non-departmental public body who deliver high impact programmes, and they deliver funding for armed forces focused projects. So they administer 10 million Armed Forces Covenant Fund on behalf of the Treasury each year, and additional funding too. So the Thrive Together programme is the flagship programme from the Armed Forces Covenant Fund Trust, but their funding's not just open to armed forces charities. It's open to VCSE organisations. There's funds available to local authorities, to the NHS. So they fund a really, really broad selection of projects. So another quote from one of our focus groups, which I love. The difference when agencies, let me just move this. So the difference when agencies actually collaborate is night and day. You see better outcomes, people feel more supported, and things don't get missed. And that was from one of the family members at one of our focus groups. And I just thought that was absolutely perfect. And that's, I guess, is one of the reasons why I'm here today, is because what we'd love to see is, you know, some more cohesion between the military sector and the VCSE sector, and work together more closely. And I know we would absolutely love to see greater representation from VCSE organisations, you know, at things like our armed forces operation groups, because, you know, all service organisations are veteran supporting or armed forces supporting organisations. Whether you identify them, you know, they are accessing your support day to day. So what can you do as an organisation to support the armed forces community? Identify them, because it's really hard to pay due regard to the impact of service life, and if you don't identify that somebody is a member of the armed forces community. Again, not all people identify as veteran. So I think the terminology is quite important. So have you ever served in the armed forces, or are you immediately related to someone who has? You know, and if you can record that too, perfect. You can build up a picture of the need across your organisation. Do you know how many members of the armed forces community work for your organisation? Do you have reservists that are working for you? And if you do, could you identify an armed forces champion for your organisation? If you don't have the capacity to provide training for your entire organisation, is there one person that you could nominate that could be that linchpin between the armed forces partnership and your organisation? That would be, we've seen that quite successfully. We've seen there's a brilliant armed forces champion being nominated within the adult social care team, and has actually made such a huge difference for the team to have that one point of contact, who will then attend the relevant meetings and engage with us. Could you include an armed forces module on your induction training? I've signposted some at the end of this PowerPoint presentation. They're getting a little bit more complicated as they go on. So, do your HR policies support families? Does it support reservists? Is that something you include or something you've thought about? Have you signed the Armed Forces Covenant? Or could you apply for the Armed Forces Employer Recognition Scheme? And finally, have you considered the implications of the Armed Forces Covenant legal duty and the upcoming changes on your organisation? So, are you paying due regard to the armed forces in your work? But again, I think a lot of this all comes back to just the importance of identifying people in the first place. It would be great if everybody had it as part of their standard questions, name, address, date of birth, have you ever served in the armed forces, or are you related to somebody who has? And that will also, having that knowledge of the Armed Forces Covenant legal duty will help you in your work. It will help you to advocate for the veteran community. And identifying them will open up a whole host of not just charitable services and support that's available, but also statutory support as well. And so I'm just going to touch on that very quickly before going to some questions. So I've linked them all in here. There is a whole host of statutory support available for the armed forces community. There's a dedicated mental health service, Op Courage. Little well known is Op Restore, which is a statutory physical health and wellbeing pathway for veterans. You do need a GP referral for that. The Veterans Orthopaedic Service, one of the things we know is that actually veterans are, and a lot of the veterans we see with health difficulties are, the top issue is musculoskeletal difficulties. So there's a Veterans Orthopaedic Service, there's support for the justice system, there is a housing and homelessness pathway called Op Fortitude, an employment service. So I think you can see there's a whole host of statutory services there that are available that you can refer into, right through to, we have a GP friendly accreditation system. There's the Veteran Covenant Healthcare Alliance that provide resources and training to NHS services. There's a framework for care homes. The DWP have an armed forces champion in every region. So there's a whole host. And we've just seen the new initiative called Valor. So we've just seen 50 million announced by the government for a new support system. And that's currently in pilot phase in the north. So we will see a whole new system being brought in over the next 12 months, and we will see a network of armed forces accredited support centres introduced as part of that. But there's some links in there should you want to find more info. And this link here links to Veteran Covenant Healthcare Alliance. It has leaflets on there for all of these statutory services. I've got some local services for you here. I won't go through them all, so we've got some time for questions. But we've got Fabulous Stepway local in Worcestershire, providing a whole host of support for veterans. They've got service women's groups, they've got families groups, they've got a huge range of support and a brilliant SAFA branch too. And then YSS, many of you may know, have 2 veteran projects supporting veterans and veterans' families in the justice system, which is funded through the Thrive programme. So we have our welfare officers. And then finally, a bit of a snapshot. There are almost 2,000 military charities, which is phenomenal. A good place to start in navigating those is COBSIO, the Confederation of Service Charities, which oversees the governance of their members. So all of the organisations signed up to COBSIO have been quite rigorously vetted. So if you are looking for an organisation, it's a good place to start. And then we've got the government directory here. But there are links embedded to this. And as I said, I'm going to stop sharing and put my camera back on. And if anyone has any questions, I am happy to answer. But like I said, I will share that along with all of the embedded resources.
You could use your electronic hand to ask questions. Is that okay?
Sorry, I'm on my phone. It's taken me ages to get on and I can't see where to put my hand up.
Oh, no, that's okay, Anne. Carry on.
We're just doing a funding bid, the Armed Forces Covenant Trust Fund, to help veterans and their families. So I've just got a couple of questions around the demand for advice on benefits, debt, money management, all the kinds of things that we do. So is there a high demand for that?
Yes, absolutely. But if you want to get in contact with me, and my Thrive email is on the PowerPoint. So we work really closely with the Armed Forces Covenant Fund Trust. So we meet with them every other week, and all of their funded projects are asked to engage with the Thrive programme. But what I can do is I can supply you with all of our consultation data. So if you want to utilise that in bid writing or shaping your services, I'm quite happy to share all of that data with you.
My laptop's died. I'm waiting for a charger to come through.
But we do through this programme fund a Citizens Advice Bureau in the northeastern Yorkshire, and it has been a hugely successful project.
And in a previous life. Yeah, in a previous life, when I was at shelter, I did guides and worked with COBSIO and British Legion and all the supporting organisations as well. And I think it's like you said, what we need to start doing, which we don't do here, and I've done in previous citizens' advice, is make sure that it's part of the profile of our clients that we're seeing, so we can build that picture on what we need to do, how we need to reach people. And I wanted to remind people, and I can send you the information of the services that we've got, the generalist advice services and the specialist advice services. And the fact is, I know that there's always a waiting list, but what we do is a text and ring back. So if people can't get through straight away, they can text us and we'll get back to them within a couple of days.
Thanks, Anne. If you send that information through to me, I'll make sure it's circulated to everybody
I'll
here.
Do that. And the other thing is, the more funding that we get for specific projects, then we can see people much quicker within that specific cohort of people. Because like now, currently, we've got services in ASPI, mental health unit, benefits and debt specific, food bank with money management. So lots of different projects happening. So I'll send that through, and through the KAIS, we've got the because we're doing the community advice information to specific organisations as well, and we've got bookmarks which shows what we've got in South Worcestershire. The North are doing it as well. So and all the advice services that we've got in Herefordshire as well.
Great, thanks, Anne. There is a question in the chat from Sean. Our trust is weighing up, I think this is a housing trust, is weighing up the opportunities to create Armed Forces veterans supported housing services in one of their larger vacant properties. Are there any starting places or organisations or people that you would recommend, Gemma, that they could speak to about this?
Yeah, absolutely. I'd absolutely recommend them coming along to one of our ops group meeting. Again, I'm happy if you want to send me an email to connect you with some relevant people. There's been some great work being done in Worcestershire, actually on housing initiatives for veterans, and some really great social housing builds that have been done. So I'm happy to connect you with some relevant people and have a chat about that.
Great, thank you. Thanks for the question, Sian. Katie O'Brien from Bewdley Medical Centre has said about the GP surgery planning to have chats and coffee mornings with the veterans. So that's great to hear. Caroline Sutton from CALC, from the County Association of Local Councils, is going to disseminate the information to parish and town councils, which is brilliant. And yes, and then we're just really keen for Stacey to be, when you email Gemma or Stacey, could you make sure you email Stacey so she's got a log of the sort of inquiries that are coming through for Worcestershire, as Stacey's sort of responsible for making sure that we get this information out as well. So it would be great if you could take a note of the email address that Stacey's put in the chat as well. So for the ops group. So that's brilliant. Any other questions? Mark?
Thanks. Hi, yeah. Mark Armstrong. I'm a Deputy Lieutenant within the county, with asked by the Lord Lieutenant to lead on veteran matters. I happen to do 33 years and 12 days in the army myself, not that I was counting. I guess when I go around the breakfast clubs, etc., and chat to veterans, there's, and same with the British Legion, the older veterans seem to get together. We seem to be missing, dare I say it, that group, maybe under 55. And I'm just interested in how people know how we can get engaged with them. They sort of feel that, well, the British Legion's for old people, or this is for old people. Is how to make a community. If you've got any ideas how we make more of a community of those that are kind of below that level. So the Breakfast Club, they tend to be a lot senior. The British Legion, they're senior. People coming together. So really interested in to know what we can do just in terms of making a community, which then raises awareness, then people share things and they get together, etc., of that middle cohort.
Yeah, Mark, actually the week after next, our independent facilitator is going to be doing some focus groups with younger veterans, because one of the things we noticed in our consultation, like you said, we were only hearing the voices of much older veterans and the families of much older veterans. And we fund several hubs across the Midlands, and they're not seeing the younger cohort coming through either. So we are working with a couple of associations to do some focus groups with that demographic, and to ask that question. You know, how would you like to access support? You know, does the hub model work for you? Do breakfast clubs work for you? You know, what is it that you want, you know, from the support as a younger veteran? And all of our consultation data, and we agreed at the start that we make that public, so that everybody can utilise that. So we always publish it on our website so that everybody can use that. So once that report's drawn up, you know, quite happy to share those findings with you. But it is something, as a portfolio, we are very much focusing on, you know, trying to improve engagement with those with that young.
Thanks, Gemma. If you could share that with me, that would be super.
Good. Yeah, absolutely.
Gemma, I was just thinking that it was great to see there's so many charities set up to support veterans and people serving. Do you think in Worcestershire there is enough provision from charities, or are they up? It's great to hear that Anne from Citizens Advice is looking to develop that service. But do you think there are any other gaps that we need to be aware of from your perspective? Any gaps in services that need to be addressed?
VCSE perspective? Can you hear me okay? Because my camera. Can you hear me
Yeah.
okay? Because my camera is playing up a little.
We can hear you.
So, our consultation, we looked at gaps. Some of the gaps that we saw weren't particularly around veteran cohorts, although there was gaps around vulnerable groups, so veterans in the justice system, those with substance misuse difficulties. But there were a lot of gaps for families. Our whole consultation report talks about the difficulties that families have accessing service, gaps for female veterans, not feeling able to access support. What I can do is when I send you the presentation, I can put an extra slide in there that will break down all of the areas of focus and the gaps in our consultation, so people can see those findings in there in a sort of simplified format.
That would be really useful. Thank you. Yes,
but we are quite well served for veteran support across Worcestershire. We have some brilliant organisations, like I said, Stepway are doing some phenomenal work. What we do need to see is more cohesion between the armed forces sector and the voluntary community sector. And I think just that closer working relationship, so that we are identifying those people when they come through services.
Are there any models of good practice where cohesion is working in other parts of the country that Worcestershire could look at developing or modelling the way we work here?
There is some brilliant work being done in Shropshire. Shropshire have a fantastic outreach programme that they do outreach all across the county, and that outreach involves many VCSE organisations being at those outreach sessions too. And I see quite a much closer working relationship between the VCSE and Shropshire as a result, because of that. So there is some great work being done there. And something which we're also trying to replicate that outreach in Nottinghamshire as well.
Oh, great. Thank you. If any organisations here are interested in getting more involved, it would be really good to hear from you. So if you could email the email that Stacey has put in the chat, and then we'll get in touch with you and look at how to develop more cohesion between the sectors. So it would be great to strengthen. It would be fantastic, wouldn't it, if we could strengthen that cohesion and working together better.
That's it. And we've got a brilliant operations group made up of cross-sector caseworkers, and we would love to see more people coming along to that operations group. You don't have to attend a meeting, but that is there if you're working with someone in the armed forces community, and you've got a particularly complex case and you'd like to discuss it with other people, then do come along. They're a brilliant group, and we will sit together and we will collaboratively problem solve it together. And sometimes I think it's just attending some of those meetings and building up that trust definitely strengthens the work that's going on.
Stacey, would you be able to include the details of that in the email that we're going to send out to everybody? Or between Gemma and Stacey, would you be able to make sure that information's available for everybody to look at? Thank you.
Yeah, absolutely.
Great. Anne?
Thanks, I found my hand now. Yeah, we do, like I said, as part of CAIS, community advice, information sharing, we've got a presentation that we can do across county or to specific districts as well, which shows what's happening and who to contact in your area. So that would be good if we could come along to one of these meetings and do that. The other thing I didn't mention is the bid that we're putting in, we're doing it in collaboration with Age UK Wyvern, so across Herefordshire and South Worcestershire and Shropshire, so it's all about kind of working together. And Shropshire and Telford did they're putting a bid in as well as part of that. So I know that there's lots of things happening across the country, really. So like you said, it is just working together so that we're collaborating and making sure that we're sharing information, working together, not reinventing the wheel that we're quite good at doing.
Yeah, absolutely. Yeah, fantastic. Thank you, Anne. Well, that's been so interesting, I think. I hope you all found that interesting. And thank you so much, Gemma, for providing all that wonderful information. And hopefully people will go away with lots of food for thought. And as you said, please do get in touch if you've got any further questions or anything at all that you'd like to say or get involved with. Please do use the email in the chat to make contact. But in the meantime, I think unless anybody's got any other questions, we'll close the meeting. Is that any other questions? Last call? No? Okay, brilliant. Thank you so much, everybody. Thanks for coming. See you all soon.
Bye.
Take care.